Section 29 of Gray's Anatomy, Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4 by Henry Gray. Trigeminal Nerve, Part 2. Branches of distribution. These are divisible into four groups, viz., orbital, palatine, posterior superior nasal, and pharyngeal. The orbital branches, rami orbitalis, ascending branches, are 2 or 3 delicate filaments which enter the orbit by the inferior orbital fissure, and supply the periosteum. According to Luschka, some filaments pass through foramina in the frontoethmoidal suture to supply the mucous membrane of the posterior ethmoidal and sphenoidal sinuses. The palatine nerves, nervus palatini, descending branches, are distributed to the roof of the mouth, soft palate, tonsil, and lining membrane of the nasal cavity. Most of their fibers are derived from the sphenopalatine branches of the maxillary nerve. They are 3 in number, anterior, middle, and posterior. The anterior palatine nerve, nervus palatinus anterior, descends through the pterygopalatine canal, emerges upon the hard palate through the greater palatine foramen, and passes forward in a groove in the hard palate, nearly as far as the incisor teeth. It supplies the gums, the mucous membrane, and glands of the hard palate, and communicates in front with the terminal filaments of the nasopalatine nerve. While in the pterygopalatine canal, it gives off posterior inferior nasal branches, which enter the nasal cavity through openings in the palatine bone, and ramify over the inferior nasal concha and middle and inferior meatasses at its exit from the canal. A palatine branch is distributed to both surfaces of the soft palate. The middle palatine nerve, nervus palatinus medius, emerges through one of the minor palatine canals and distributes branches to the uvula, tonsil, and soft palate. It is occasionally wanting. The posterior palatine nerve, nervus palatinus posterior, descends through the pterygopalatine canal and emerges by a separate opening behind the greater palatine foramen. It supplies the soft palate, tonsil, and uvula. The middle and posterior palatine join with the tonsillar branches of the glossopharyngeal to form a plexus, circulus tonsillaris, around the tonsil. The posterior superior nasal branches, rami nasalis posteriores superiores, are distributed to the septum and lateral wall of the nasal fossa. They enter the posterior part of the nasal cavity by the sphenopalatine foramen and supply the mucous membrane covering the superior and middle nasal conchae, the lining of the posterior ethmoidal cells, and the posterior part of the septum. One branch, longer and larger than the others, is named the nasopalatine nerve. It enters the nasal cavity through the sphenopalatine foramen, passes across the roof of the nasal cavity below the orifice of the sphenoidal sinus to reach the septum, and then runs obliquely downward and forward between the periosteum and mucous membrane of the lower part of the septum. It descends to the roof of the mouth through the incisive canal and communicates with the corresponding nerve of the opposite side and with the anterior palatine nerve. It furnishes a few filaments to the mucous membrane of the nasal septum. The pharyngeal nerve, pterygopalatine nerve, is a small branch arising from the posterior part of the ganglion. It passes through the pharyngeal canal with the pharyngeal branch of the internal maxillary artery, and is distributed to the mucous membrane of the nasal part of the pharynx, behind the auditory tube. The pharyngeal nerve, pterygopalatine nerve, is a small branch arising from the posterior part of the ganglion. It passes through the pharyngeal canal with the pharyngeal branch of the internal maxillary artery, and is distributed to the mucous membrane of the nasal part of the pharynx, behind the auditory tube. The mandibular nerve, nervus mandibularis, inferior maxillary nerve, supplies the teeth and gums of the mandible, the skin of the temporal region, the auricula, the lower lip, the lower part of the face, and the muscles of mastication. It also supplies the mucous membrane of the anterior 2/3 of the tongue. It is the largest of the 3 divisions of the fifth, and is made up of 2 roots, a large sensory root proceeding from the inferior angle of the semilunar ganglion, and a small motor root, the motor part of the trigeminal, which passes beneath the ganglion and unites with the sensory root just after its exit through the foramen ovale. Immediately beneath the base of the skull, the nerve gives off from its medial side a recurrent branch, nervus spinosus, and the nerve to the pterygoides internus, and then divides into two trunks, an anterior and a posterior. The nervus spinosus, recurrent or meningeal branch, enters the skull through the foramen spinosum with the middle meningeal artery. It divides into two branches, anterior and posterior, which accompany the main divisions of the artery and supply the dura mater. The posterior branch also supplies the mucous lining of the mastoid cells. The anterior communicates with the meningeal branch of the maxillary nerve. The internal pterygoid nerve, nervus pterygoideus internus. The nerve to the pterygoideus internus is a slender branch, which enters the deep surface of the muscle. It gives off one or two filaments to the otic ganglion. The anterior and smaller division of the mandibular nerve receives nearly the whole of the fibres of the motor root of the nerve, and supplies the muscles of mastication and the skin and mucous membrane of the cheek. Its branches are the mesenteric, deep temporal buccinator, and external pterygoid. The mesenteric nerve, nervus mesentericus, passes lateralward above the pterygoideus externus, in front of the temporomandibular articulation, and behind the tendon of the temporalis. It crosses the mandibular notch with the mesenteric artery to the deep surface of the masseter, in which it ramifies nearly as far as its anterior border. It gives a filament to the temporomandibular joint. The deep temporal nerves, nervus temporalis profundi, are two in number, anterior and posterior. They pass above the upper border of the pterygoideus externus and enter the deep surface of the temporalis. The posterior branch, of small size, is placed at the back of the temporal fossa, and sometimes arises in common with the mesenteric nerve. The anterior branch is frequently given off from the buccinator nerve, and then turns upward over the upper head of the pterygoideus externus. Frequently a third or intermediate branch is present. The buccinator nerve, nervus buccinatorus, long buccal nerve, passes forward between the two heads of the pterygoideus externus, and downward beneath or through the lower part of the temporalis. It emerges from under the anterior border of the masseter, ramifies on the surface of the buccinator, and unites with the buccal branches of the facial nerve. It supplies a branch to the pterygoideus externus during its passage through that muscle, and may give off the anterior deep temporal nerve. The buccinator nerve supplies the skin over the buccinator, and the mucous membrane lining its inner surface. External pterygoid nerve, nervus pterygoideus externus. The nerve to the pterygoideus externus frequently arises in conjunction with the buccinator nerve, but it may be given off separately from the anterior division of the mandibular nerve. It enters the deep surface of the muscle. The posterior and larger division of the mandibular nerve is for the most part sensory, but receives a few filaments from the motor root. It divides into auriculotemporal, lingual, and inferior alveolar nerves. The auriculotemporal nerve, nervus auriculotemporalis, generally arises by two roots, between which the middle meningeal artery ascends. It runs backward beneath the pterygoideus externus to the medial side of the neck of the mandible. It then turns upward with the superficial temporal artery, between the auricular and condyle of the mandible, under cover of the parotid gland. Escaping from beneath the gland, it ascends over the zygomatic arch, and divides into superficial temporal branches. The branches of communication of the auriculotemporal nerve are with the facial nerve and with the otic ganglion. The branches to the facial, usually two in number, pass forward from behind the neck of the mandible and join the facial nerve at the posterior border of the masseter. The filaments to the otic ganglion are derived from the roots of the auriculotemporal nerve close to their origin. Its branches of distribution are anterior auricular, branches to the external acoustic meatus, superficial temporal, articular, parotid. The anterior auricular branches, nervus auricularis anteriores, are usually two in number. They supply the front of the upper part of the auricula, being distributed principally to the skin covering the front of the helix and tragus. The branches to the external acoustic meatus, nervus meatus auditorii externi, 2 in number, enter the meatus.